Hello, my name is Holly Hannick. I am a pediatric nurse practitioner student at Maryland University, and today I will be doing a head, ears, eyes, nose, throat exam. This is my patient Tom. He's not a real patient, but he is going to sit in for me today. All right. Hi Tom, my name's Holly.
How are you?
How are you doing today?
Doing all right.
All right. I'm going to do an exam on you today and just examine your upper body, your head, your nose, your throat, your eyes, and just make sure everything checks out okay. All right?
Sounds great.
If I'm during the exam, if there's any pain or pressure, just please let me know so I can write that down. Okay?
Sounds good.
All right, I'm going to start out with your head. I just want to take a quick look and make sure everything looks symmetrical. I'm going to palpate your head. Make sure I don't feel any masses. Alright. Now I'm going to palpate your sinuses. Any pressure or pain while I'm palpating?
Oh.
Now let's go get your neck. Any pain while I'm touching?
No.
Okay. Alright, now I'm going to take a listen to your carotid arteries. Good. Now I'm going to palpate your lymph nodes. So just go ahead and look straight at me. No masses there. That's good. Alright, next I'm going to do an exam over your thyroid. So what I'm going to have you do is just stay still for a second, and then I'm going to have you take a drink of water so I can further palpate that. Alright. I can just have you take a drink of water. Feeling your trachea while I'm here. No abnormalities there. Thank you. Alright. Now we're going to move on to the eye exam. I'm going to have you stand up for me, and we're going to work on your vision chart here. Okay, so I just need you to read the smallest line from left to right that you can see. Oh, I need to have you cover one eye though. So choose an eye. It doesn't matter which eye you start with.
Smallest. L, T, F, C, H.
Okay, just pick one line.
Oh.
So like you can, when to start here.
Okay. D, H, J, E, S.
Okay. Now go ahead and switch eyes.
D, H, J, B, S.
Okay. Looks good. Go ahead and sit back down for me. I'm going to take that from you. All right, now we are going to do the cover and cover test, which what I'm gonna have you do is just look at my mouth, and I'm gonna cover one eye and uncover it, and I'm looking for the constriction of your pupils. All right. Okay. Okay, thank you. All right. Next, I'm gonna do the confrontation exam. So what I'm going to do here is I'm going to be holding my hands out a little bit further back, and as I bring them in, I want you to tell me when you see them in your peripheral vision, okay?
See him?
Okay.
See him?
Okay.
See him?
Okay, perfect. Now, I'm going to do our next test here. I want you to go ahead and just keep your eye on the tip of this, and I'm going to have you follow it. But I want you to keep your head looking at me, but just follow this with your eyes. Okay. Perfect. All right. Now I'm going to go ahead and just inspect the outside of your eyes. Just want to take a look at your eyebrows and make sure your eyebrows look symmetrical, which they do. No change in color in the hair of your eyebrows. Now can you go ahead and close your eyes for me? I'm just inspecting your eyelids. All looks well. You do have a little redness over here on this right eye. A little bit of swelling, but it's going down. So go ahead and look up, or look right at me, please. So I'm taking a look at your sclera and at your lenses, at your retinas. Everything looks pretty good there. No edema or anything underneath of your eyes. All right, so now I'm gonna take a look at your eyes. So I'm gonna turn the light off. All right, I'm gonna start over here. I just want you to look straight ahead, and I'm gonna take a look at your eyes. So first I'm going to check for some constriction, which is good. Great. Pupils are both equal and reactive. And now I'm going to take a look at the inside of your eye, checking on the fundus. Okay, just looking straight ahead. Turn the light back on. Let our eyes adjust here for just a second. Any pain? Did you feel any pain while I was touching on the upper part of your face?
No.
No pain. Okay, awesome. All right. Next, we are going to move on to your hearing. So this test is going to be to see whether or not you can hear the vibration of this tool in both ears or one or the other. Okay? So just go ahead and look straight forward. And tell me if you can hear the vibration on both sides of your ears or just one or the other. Could you hear it on either ear or one or the other?
Yes.
You could hear it on both or just one or the other?
Both.
Both. Okay. Perfect. All right. In this next test, we're going to test for, which is the Ryan test, we're going to test for conduction versus bone conduction versus air conduction. I guess I should explain to you what to do first. So I'm going to tap this. I'm going to put it to the back of your ear, and then I want you to tell me when you can no longer hear it on the bone, and then I'm going to switch it to your ear, and then I want you to tell me when you can no longer hear it in your ear. Okay?
Okay. You can't hear it in the bone. It's gone.
Okay, perfect. same thing on the other side.
Okay, it's gone. It's gone.
Okay, perfect. All right, our next test is called the whisper test. What I'm going to do is I'm going to whisper a number in each ear, but I'm going to do it in 3 different sections to see if you can hear what I'm whispering in each ear. So I'll go 1, 2, 3, 1, 2, 3. Okay? 99. Can you say that what I say out loud?
99. 100. 205. 12. 25. 210.
Perfect. Okay. So now I'm going to go ahead and inspect your ears. I want to go ahead and take a look at the outside of your ears, and I want you to tell me if for any reason any of this is painful while I'm palpating the outside of your ear. Checking for any abnormalities or any masses or growths. Is any of that painful?
No.
Okay. Great. Now I'm going to go ahead and take a look at the inside of your ear. So what I'm looking for now is just to check to make sure I can see a pearly gray tympanic membrane, which I do, a little bit of earwax, which is normal, no fluid behind the eardrum. Again, a little bit of earwax, a pearly gray tympanic membrane, and no fluid behind the eardrum. Now I'm going to go ahead and take a look at your nose. I'm going to palpate along the bridge of your nose, checking for tenderness or any kind of masses or abnormalities. No pain there when I'm touching your nose, correct?
No.
Okay. Now I'm going to take a look at the inside of your nose. No masses. No blockages. The membranes are pink and moist. Okay. Now I'm going to go ahead and inspect your mouth and your gums. So if you could just smile for me. I'm going to go ahead and shine this light just to take a look. Okay. Go ahead and lift up on your gums. Teeth look good. Gums are moist and pink. Okay, I'm going to ask you to stick out your tongue. Go ahead and open your mouth and stick out your tongue. And say ah for me.
Ah.
Okay. I can see your uvula. I can see your... I'm going to go ahead and move your tongue over to the side. Everything looks moist and pink. Go ahead and say ah again. Stick out your tongue.
Ah.
Okay. Back of your throat looks pink and moist. No infection noted. All right. And that is the end of our exam. Thank you so much.